Hi, good night, good day, good afternoon to everyone. This is the Caribbean Climate and Health Responders Course Education for Action, second edition. This is the eighth session, and what we will be looking at this afternoon is the health system resilience in a changing climate. I just want to thank the sponsors, Columbia Mailman School of Public Health, Global Consortium on Climate and Health Education, Earth Medic, Earth Nurses, PAHO, UE, and CIMH. For the people who are new and the people who are returning, we have an interpretation. Live interpretation is available in English and Spanish using the circle button. That is the button you would find on your lower right-hand side. That's the button you would find on your lower right-hand side. So again, we are in session number 8, health system resilience in a changing climate. And I want to say thank you and welcome to all the people who are returning and all the new people who we have captured for this afternoon, and hope that you enjoy your stay for the time that we have. So some of the learning objectives: health system resilience in a changing climate, explain how vulnerability assessments are used to understand the individual, community, and health systems impacts and vulnerabilities. Then we look at identifying how the risks and vulnerabilities to critical healthcare infrastructure delivery and supply chains from extreme weather events and other climate impacts can be invented. We're looking at explaining the comprehensive scope of climate change and health surveillance. And then we're looking at explaining or understanding the importance of collaboration on information sharing across departments, ministries, agencies to support integrated joint surveillance and benefits to individual agencies. Again, we're just touching on some logistics. The session is 90 minutes long. During that time, you'd enter your questions for the presenters to answer. You would find that button just almost in the middle of the Zoom link, the Q&A button. The session is also recorded. The reference material and slide decks will be included on the website. Again, we are offering CME credits. One free CME credit is applied per session attending in person. Applications made by completing the Google link posted in the chat before the end of the session. So again, you're looking at the link at the end of every session. The link is live until 2 p.m. The day following the session. Again, we offer a certificate of participation. Participants who attend 70 or over of the live Zoom sessions and pass the final exams with a score of 70 and over, at the end of the course will be awarded a certificate of participation in climate and health from Earth Medic, Earth Nurses, and from the GCCHE. Again, we have two presenters this afternoon. Again, I'm the moderator, Mr. Ancil Bonair. So we have Dr. Karen Polson-Edwards, a Jamaican national beginning her career in medical entomology in 1994 after earning a Bachelor's of Science in Zoology. She worked at the Caribbean Epidemiology Center, CAREC, before pursuing a Master's of Science from the London School of Hygiene and Tropical Medicine. In 2007, she commenced her Doctor of Philosophy Studies in Zoology with the United States Center of Disease Control and the University of the West Indies. Dr. Polson-Edwards became involved in climate change and health in 2002 through projects like the Intergovernmental Panel on Climate Change and Dengue. She later joined the Pan American Health Organization. In 2018, she provided technical support in climate change and health in the Americas. And the other presenter for tonight is Dr. Nicole Dawkins-Wright, is a dedicated healthcare specialist and public health practitioner focused on enhancing the resilience of the healthcare system for optimal delivery during emergencies and disaster. Serving as a senior director at the Ministry of Health and Wellness in Jamaica, she coordinates emergency and disaster management efforts while also serving as the National Disaster Coordinator, Consultant Emergency Physician, and Climate Change Focal Point, with qualifications including a bachelor's in medicine and surgery, a doctor of medicine in emergency medicine, and a master's in public health with a focus on disaster management. She's committed to advancing healthcare and disaster preparedness. So we're having Dr. Karen Polson as the first presenter for this afternoon's session. So you could take it to be Dr. Polson.
Sorry, good afternoon. I think Dr. Dawkins-Wright is going to go before. So please go ahead,
okay.
Dr. Dawkins-Wright.
Thank you very much, everyone. Good morning, good afternoon, good evening. So nice to see all of you on board here. It's a very important topic, and I'm going to try and use Jamaica as a case study to kind of put some insight and align you around the conversations for policy to support our actions in climate change, to support climate change and health, and in the protection of health and wellness. And so I think probably I'm going to start sharing. Just now. And we would have gone into the objectives in terms of our session for today. So what I'm giving you is a little snippet. The policy conversation around this topic is a very wide area, so it's very difficult to get into it. So I'm just whetting your appetite to the topic just now. And I'm giving you the policy perspective, and obviously a little bit from the disaster management perspective. That's my background, and it's easy to appreciate why, but it's so much more than that. I am trying to advance the slide. Ancil, can you help me here? It's not advancing.
You try just pressing enter, Nicole, on your.
Yeah. Okay,
try pressing spacebar.
Spacebar.
Okay,
let me stop share and reshare again, maybe.
Yeah, I can also jump in and share your deck for you if you're having
that would be good.
Yeah.
If you could do that, yeah, that would be appreciated. Go right ahead, please.
Can you see?
Yes, I am seeing it.
Right. All right.
Right. So we spoke a little bit about the objectives, and pretty much can move on to the next slide.
Good, Haley.
Quickly. And we'd have pointed out to get some insight into the policy conversations. And the word I wanted to take with you
Dr.
is
Nicole,
the
your
matter
slides
of a
are up.
transformational change. And so I've dubbed our conversation 4.0 to kind of help you to remember some of the concepts that I want to speak to. Because I'm going to give you 4 examples for you to appreciate the value of policy change to get the impact that we're looking for. I'm going to try and present 4 arguments as to why policy is a pivotal change. The 4 focus areas when we give consideration to the policy actions that support climate change and health, and 4 avenues that we're taking in Jamaica as the case studies to help in terms of our health and health determinant sectors for action on climate change. So we talked with some pertinent data to show off some exposure pathways. Generally, Dr. Polson-Edwards go into a lot more details, present the co-benefit strategy as the policy perspective, and some examples that we're using here in Jamaica. I want you to throw back to there's a wealth of information that support the action that we're taking, and just one of them, which is still very current, one that's published on the screen from our NCD Alliance, which highlighted 4 key messages around the activities that support climate change and health, recognizing that there are 2 challenges for our current era, and these are areas that we need to manage together. So there's a lot on our table. But amongst the messages of these 4, we have a clean energy conversation around active transport. We have intervention that speak to the matter of addressing NCBs because that's a focus area. And then we have the matter of the effective strategies that are well used in terms of attention to climate action and health. My focus, however, is on the 4th message, what we as government sector, government players, stakeholders for policy, and our different ministries and across different departments and agencies have to do in order to galvanize around the actions that we need to take for health. Next slide for me, please. Next slide. And so I wanted to give consideration to what we're really talking about and what has been clearly illustrated. If you go back one, is that most of this disease causation has to do with what we're exposed to. And therefore, for the most part, we should be able to address some of those things. So that's a principle and a concept that I wanted to keep in mind. What the science is showing us, however, is that in as much as there are a lot of exposure and it's highly variable, and so it's sometimes a little difficult, the matter of health conditions and outcomes, most of the risk factors tend to cluster around for certain different conditions. So that's a plus for us, because it means that if you attack a set of risk factors that cluster around each other, you're attacking multiple different health conditions that can modify the pathogenesis and outcomes of these diseases. There's a concept that we've been working with in terms of managing health and health protection and promotion. That's very common speaking our language today, and that's the life course perspective. Because we have so many factors that contribute to disease causation from the perspective of climate change, the key gel and glue to all the activity has to do with coordination. Coordination of the various different efforts that come from all the players that contribute to supporting an adapted lifestyle for climate change and to establish that enabling environment that we need to address the interdisciplinary and integrated interventions that we require as a coordinated approach to the life course perspective. What has been clearly demonstrated, though, is that if we are going to get any kind of change in terms of creating that paradigm shift to harness the powers that we can get from the life perspective into policy development, then what is required is the application of a risk management approach to the exposures that we know are going to be exacerbated by climate change for all persons from in utero throughout their full life course into mature health being. And that the policy framework for public health around partnerships and advocacy seeks to strengthen the intersectoral partnerships that support the actions, not just across the different entities, but across all sectors of society and across all the government players. Next slide. Next slide. And so I'm going to start off with the first example, which I think is very familiar to most of us. The first one has to do with general improvement in environmental conditions that we have recognized have contributed to improvement of health standards. If you can go back one slide, please. And that's in the context of what happened with health promotion and sanitary standards. It took significant amount of policy action across multiple sectors to realize what the data is clearly showing, that whether you live in low income or high income countries, our health status is much, much improved because of the policy shift that led to improvement in general sanitation standards that requires all players to participate at the community level. So much so that the communicable diseases are reducing across all countries. And it now manifests that we've seen an increasing rise in the occurrence of NCDs as primary contributors to persons who lose their life too early. If you look at the example, whether you're an economist or whether you are in the business of providing work surface and just looking at what works better for health, it is clearly beneficial. The picture on the right of the screen is a look at what the benefits of primary care approach to managing health in the United States. The next slide, please. My second example that I want to give you in terms of how policy has impacted and improving life status has to do with vaccine preventable diseases. It took a great deal of effort, and despite what we've heard about immunization in current time, you don't have to look too far to recognize that a significant contribution to the reduction of the number of childhood deaths from some of the most lethal diseases is attributable to routine vaccination programs. Vaccination programs that are mandatory across the different stages, especially early in childhood. And this is what has been shown to improve children passing through the early stages of life, so we are now into adulthood. We can't get away from the facts. The numbers speak for themselves. The third example, next slide. A third example is one that's closer to home, and that is to look on the number of deaths that are resulting from natural disasters. Regardless of where you are, especially in the context of climate change, the numbers of disaster situations are increasing, and they're increasing dramatically. What is decreasing is the number of persons who are losing their lives because of this. And what it is attributed to is the fact of structuring disaster risk reduction into our regular routine program for emergency preparedness from the policy level at all levels and sectors of societies that bring together all the players that participate in a comprehensive disaster risk management program that has caused a reduction in the number of persons who are significantly impacted by natural disasters. The next slide. The fourth example is probably a little bit more akin to what we need to give consideration to in terms of climate change. And it's more aligned to it. And that has to do with fatalities related to road traffic crashes. This is something that's very current, and it's a very challenging situation, and exposure to that cause persons to lose lives, impacts life adversely in several ways. There's a lot of increasing mobility, so this is not likely to be a challenge that's going to go away. However, in the last 2 decades, there have been significant attention to try and improve the amount of persons who are affected by road traffic crashes, either to reduce road traffic crashes in and of themselves, or if it does happen, use the persons who are injured and provide care to them.
Hi, good day. Excuse Dr. Wright. You started to break up.
Could you speak
I'm
a
sorry.
little
I'm
clearer?
asking to talk a little slower.
Oh, sorry. Is my audio much better now?
Yes, it is.
Okay, my apologies for that. And let me slow down my speech. I've been known to speak a little fast. Sorry, forgive me, my interpreters. In the context of road traffic crashes and the data that is available from a global perspective, it doesn't look too impressive at first glance. However, if you zoom into what the figures are showing, certainly in particular where policy has gone across multiple sectors, across different levels of government, and involves several players in a concerted action, especially, for example, in the European area, for the first time, there's a change in the trajectory that reflects the number of deaths due to road traffic crashes. This is what it will take to cause a change in the number impacted in terms of policy change for climate change. And this is what we need to use as our current example, because this is something that we're managing at this present time. Next slide. So let's look at what we're talking about in terms of NCDs, or non-communicable diseases. And non-communicable diseases and injuries have very similar features when we give consideration to what is required from a policy perspective. It requires multiple sectors playing at the same time. It requires different intergenerational activities, requires concerted action, requires a full systemic involvement of all players, and involves a significant public health intervention to try and address this. Both of these are issues that we need to address. One of the examples when it comes to climate-sensitive diseases, such as NCDs in particular, is diabetes mellitus. Most, if not all of us, are touched by diabetes. One of these, if we look in terms of the data, Jamaica and many other countries reflect those of the global data. The most common killers are due to NCDs, and amongst them, diabetes is one of the top 4 killers. It accounts for a significant number of lives lost, and most of these have similar factors that cluster around each other. A full public health intervention, a public health approach to the management of diabetes is what it takes to control the number of lives lost due to diabetes. It is going to be a similar scenario when it comes to other climate-sensitive conditions. Next slide. Let's look at 4 exposure pathways in the context of NCDs and diabetes that are similar to what we're talking about.
Perhaps we should move on to Dr. Polson's presentation.
Yes, if Nicole's having trouble getting in from Dubai.
Hi, good day, Dr. Polson. Are you in?
Yes, I'm here. So I'll go ahead. That's okay.
Yeah, we see your presentation in presentation modes. We can see your notes.
Okay.
Yeah.
You can see my notes or you cannot?
I can see your notes.
Okay. Do you see now?
No, better now.
Okay, thank you so much. Okay, so I'll go ahead and hopefully Dr. Dawkins-Wright can come in. So let me just back up a bit. So I'm speaking to the, again, climate resilience in a changing environment. And I think from the very first module of this course, we were made aware, Dr. Hospitalis did that session, we were made aware of some of the impacts that we're seeing related to climate change in our region. In the Caribbean, we're very familiar with the hurricanes and the impacts, the floods in other parts of the world, the wildfires, the droughts affecting us, and so on. And I think this is actually where Dr. Dawkins-Wright got cut off when she was actually presenting this particular graphic and mentioning the non-communicable diseases. Now, this graphic is showing us some of the ways in which climate change impacts health. What are the risks, the risk factors, and the exposure pathways? And I think this is a very familiar graphic to many persons. So there are several vulnerabilities that determine how persons are impacted. So as we are aware, climate change does not impact everyone equally because of these vulnerabilities. And we'll get into some of the factors in a little bit. But we know of the extreme weather events, the heat stress, air quality, and so on. And the health systems, which themselves have to respond and have to bounce back and have to address the impacts of climate change on health in terms of dealing with the populations, are themselves vulnerable and so have to be resilient. And we have been made aware of some of the health outcomes, as Dr. Dawkins-Wright was speaking to, the injuries, the respiratory illnesses, the non-communicable diseases, the impacts on mental health, and so on. This graphic here, I think persons are also familiar with, and this is the framework under which we work when we're speaking to building climate resilient health systems. And this is the framework, the 10 blocks on which this is built. And so the blocks deal with the health workforce, look at areas related to climate-informed surveillance systems, health infrastructure, access to finance, and so on. So the blocks are comprised basically or compressed into about 6 areas, looking at leadership and governance, health workforce, health information systems, financing, service delivery, and essential medical products and technologies. So each of these areas are areas under which we are working to build these resilient health systems. So as we're looking at the vulnerabilities and the assessments, we have several guidelines and guidance documents that have been developed to help countries to conduct these assessments. So I'll go through a bit in terms of how these vulnerability and adaptation assessments are done. And these actually are diagnostic evaluations that are conducted to understand the health impacts of climate change in a country. And through these assessments, of course, we can then identify the most vulnerable populations and priority climate sensitive health risks that need to be addressed. And these help to provide the evidence that we need for the policymakers, as Dr. Dawkins-Wright was speaking to policy, for the policymakers and health authorities to develop the targeted strategies that are needed. So when we look at some of the vulnerability factors for the health impacts of climate change and the assessments, it's not only about understanding the potential implications of future climate change, it's about addressing the vulnerability factors that interact with climate. So we think of the biological factors, the socio-political factors, socioeconomic factors, geographical factors, and the demographic factors. So when we look at some of the groups which are most vulnerable to impacts of climate change, I recall on Tuesday in the session on mental health, Doc was speaking about these groups and the thing in terms of intersectionality, and that someone could fall into more than one group and that we have to be careful about this. But what we want to show here is that for the groupings that we use, for example, with infants and children, the climate-related vulnerabilities include heat stress, water and foodborne diseases, malnutrition, looking at pregnant women and newborn infants. Again, heat stress. Heat stress is common throughout these groups, and you'll see that the vulnerabilities go across the groups in the sense that the vector-borne diseases, the pregnant women and newborn infants, older adults with chronic conditions, infants and children will also be particularly vulnerable to these impacts. The other groups that we look at in terms of the socioeconomic status and outdoor workers, heat stress. Last week, we were in Jamaica at a real significant meeting of the health and meteorological fraternity from a few countries in the Caribbean, and we were looking at heat health and identifying the populations that are most at risk for heat stress, heat stroke, and so on. And then when we look at the extreme weather events and the dehydration, air pollution, these groups are particularly vulnerable. And so when we're looking at these vulnerability and adaptation assessments, we're looking at the fact that we need to center health equity in these vulnerability and adaptation assessments, because everyone, as I said before, is not impacted equally. And so climate change interacts with upstream drivers and determinants of health to exacerbate existing health inequities. So if there were issues before with health inequity, then climate change makes that even worse. The same with environmental determinants of health. If there are issues already existing with water quality, with vector-borne diseases and so on, climate change just makes that worse. But the point we're making here is that it is essential to apply a health equity lens to vulnerability and adaptation assessments. So how do we center health equity in these assessments? There are some tools and activities and frameworks that we can use to do this. And here are some examples. When there is engagement, it has to be and should be inclusive of the communities that are being thought of. So it's not having these discussions and not including them, because they are also can be part of the solutions. We need to also include partners from across sectors and disciplines in framing these assessments in order to inform the adaptation actions so that they can be effective. And also collecting data on health impacts of climate change using a health equity lens to better understand how the status of determinants of health and multiple health inequities compound these vulnerabilities. We also, in terms of doing the vulnerability and adaptation assessments, include a capacity assessment. And this capacity assessment is included as part of the process to identify possible changes to existing programs and actions to increase capacity and address the additional health risks due to climate change. What are some examples of the actions in these capacity assessments? Well, one of the first things is to look at what exists in the country, list the existing policies and programs within the health sector and external to the health sector that affect the climate sensitive health outcomes of interest. So yes, we're talking about the health sector, but there are health determining sectors. And as we go on through this presentation, we'll recognize, and I think it's known by all here, that it's not something that can be achieved by any sector alone. Some of the actions include evaluating the interventions. So for example, if there are interventions related to vector control or programs or policies that are looking to reduce the vulnerability or increase the coping capacity of populations, these interventions need to be evaluated. Another action would be then to review the preparedness and response plans. Dr. Dawkins-Wright was speaking to disasters. Most, if not all, our country have disaster plans. And so it is to review those plans, to look at them in terms of the extreme events, events that can happen with storms, flood, droughts, heat waves. A number of the plans may already be developed for storms and floods, but maybe not heat waves and wildfires. But that's something that has to be considered now and included when those plans are reviewed. Another example then is to gather information about the current state of health sector infrastructure and service delivery to be able to see how if they're able to cope in major emergencies. As part of the vulnerability and adaptation assessments, then there are future risk assessments, and these should describe how the current health risks could change under diverse scenarios of climate change and development, and also they should estimate the possible additional burden of adverse health outcomes due to climate change. These future risk assessments then include some steps, and one of the first steps is to determine whether or not it's possible to do quantitative estimates or a qualitative approach. If a qualitative approach is to be used, then that includes working with focus groups or doing expert interviews to estimate possible implications for health risk in the future. Whereas the quantitative approach then would look at generating models to estimate how health risks of climate change could increase or decrease over time, over decades, or over longer. So those are like doing the projections from a quantitative or a qualitative standpoint. And in terms of doing the VNAs, one of the final actions then is to identify and prioritize the policies, programs, and actions to address the current and the projected health risks, and then also to focus on assessing which health concerns merit the greatest resource allocation with the largest possible benefits. So here then we're talking about how we inventory or how we document what are some of the vulnerabilities in terms of our populations, vulnerabilities in terms of our infrastructure, vulnerabilities in terms of the health sector, to be able to address the gaps and then to be able to build on the capacities, etc., so that the systems can be resilient. So let's look also at some of the examples of efforts made as part of the conducting these adaptation assessments. Then conducting a literature review is something that could be done. There documentation that countries have, research that has been done before. Some may be published, some may not be published. And so looking to see what exists, then that in terms of doing that literature review can help to identify what are some of the options for adaptation. And then another example could be holding discussions through workshops or interviews or community meetings with different stakeholders and to discuss what are some of the adaptation measures that they have implemented, how effective they have been, and what are some of the possible new actions that could be put in place. So that was dealing really more so with looking at the assessment and the populations, making sure that those who are most vulnerable are identified so that the actions can be targeted towards them. It's not that the rest of the population would be not considered in these assessments, but it's really to ensure that no one is left behind. When we look at climate resilient health infrastructure then, so now I'm switching to the physical makeup of the healthcare facilities, hospitals, and so on. In a survey that PAHO did sometime earlier, it was reported last year, 88% of roughly 20,000 hospitals which were evaluated in the Americas were found to be exposed to natural hazards like floods and hurricanes, and 43% in high-risk zones. And this is especially important for the Caribbean because if we think about it, many of our facilities are possibly along coastlines or in flood-prone areas. So it is crucial then for these facilities to boost their preparedness efforts against climate change impacts. And so we also know that in addition to the health infrastructure being susceptible or being vulnerable, the health sector is also responsible for contributing to greenhouse gas emissions. So globally, about 4 to 10% of national greenhouse gas emissions are attributed to the health sector. And so if we were to look at the health sector, if it were a country as per se, it would account to be like the 5th largest greenhouse gas emitter. Well, 4.4% of global emissions. And 71% of these emissions are due to the production chain or the supply chain due to transportation, the type of vehicles that are used by the health sector, how waste is treated and disposed of. And so these are some of the things, how energy is used and so on. These are some of the things that contribute to greenhouse gas emissions from the health sector. So it is important then, not only for the health sector to adapt to climate change in terms of the infrastructure per se, but also to mitigate efforts against climate change. So really, we're contributing to the problem, also having to adapt to the problem, and then being vulnerable to the problem. So we have quite a bit of work to do in terms of making the health systems more resilient. And there are several guidance documents that have been produced by PAHO, Healthcare Without Harm, and other and WHO and other organizations to guide countries in conducting these assessments. Persons may have heard of the Smart Health Facility or the Smart Hospitals Project, and I believe more will be said about this in the session that Dr. Harvey and others will do, so stay tuned for that too. But when we look at operationalizing the Smart Health Facility policy, what SMART means is really safe and green. So the green part is looking at the mitigation efforts, climate proofing the facilities, and reducing the carbon footprint. And the safe is looking at the actual infrastructure through partnerships, using these toolkits to do the assessment, training, resource mobilization, and so on. And so how this is done really is that there are three parts to this. There's a hospital safety index, which is used to determine the probability of the facility to be able to function in emergency situations. And that looks at the structural aspects of it. There's also a baseline assessment tool through which information is collected to guide decisions regarding retrofitting. So once the assessment is done and a score is given to the facility, then the recommendations are made and whether to retrofit the entire the facility or it's just needs to be done over completely. And then there's a green guide, which looks at the improvements on minimizing the contributions to greenhouse gas emissions. So I'm then moving on to health and climate surveillance systems. And these all fall under the building blocks, which I mentioned earlier. So we spoke about the vulnerability and adaptation assessments. We spoke about the infrastructure. We spoke about the greening of the health sector. And then now we're looking at the surveillance systems, which is part of the information systems, which is part of gathering the evidence which is needed for us to make some changes and some decisions. What we recognize is that the surveillance systems are complex, especially when it comes to health and climate change. And they rely on intersectoral cooperation because we need to have the data from the meteorological services, environment, energy, agriculture, urban, and other sectors, so that this information then can be integrated on a platform. So we then will need the infrastructure, the technology infrastructure to be able to do this, and the capacity for the health personnel to be able to improve the data quality, to analyze and use the data. All of this require collaboration among government, academia, research institutions, and so on, because they're key to developing this innovative data solutions and translating the data into timely, quality, and comprehensive information that can be used to support evidence-based decision-making. And note that this information has to be timely, or else then it doesn't really make sense in terms of preparing the health sector to be able to respond to certain situations. Here, I introduce this because we're talking about collaboration and the need for that with different sectors. And I'm putting a plug here for the 2023 State of Climate Services report, which was released by World Meteorological Organization. And what is recognized from this report is that, and we're talking about the collaboration between and among different sectors. What is recognized is that 74% of national meteorological and hydrological services provide climate data to the health sector, but only 23% of ministries of health use this information in their surveillance systems, since only 31% of these Met services have the full or advanced capacity to deliver the tailored climate services for the health sector. So what this is showing is that there is an immense untapped potential to apply climate knowledge and services in the health sector. And this is very important. Why do we need this information for health and climate surveillance systems? The climate information is needed for us to be able to, one, understand the mechanisms of disease transmission. It helps us to identify new opportunities for intervention. We also need this information for to help to identify the populations at risk so that the interventions can be better targeted. Here, we're again talking about the populations in situations of vulnerability, which we spoke about earlier. So we need this information so that we could do these analyses and these maps to know where these groups are. We need the information to inform the timing of routine interventions so that we know at what seasons, at what times of year are the risks greater. We also need it for subseasonal and year-to-year changes in risk so that we can identify when there's a change in epidemic risk, when it is likely to occur, so that the appropriate prevention and response mechanisms can be put in place. We also need this information to help us to identify long-term drivers of disease occurrence shifts, including shifts in climate, to plan for and support future interventions, and also to help in terms of assessing the impacts of the interventions. So all this information is necessary for us to be able to enhance the reliability of the vulnerability and adaptation assessments, forecasts, research, and warnings. This just shows a graphic of what really could happen if we did have a really good integrated climate and health surveillance system. So to my left, what we see here is if we have data from the environmental sector, we have the environmental information system, from the health sector, from the climate and information on socio-demographic systems, and we input that. So we have the disease data, we have data on land coverage, we have data on temperature, precipitation, the populations, how they're moving, their vulnerabilities, and all this is analyzed. Then we can produce our risk maps, and that information that we get from those analyses can be fed to different audiences. So the policymakers, so that the warning systems can be activated, to specialists, to the citizens, so that they themselves know what they need to do, what to expect, and the information can be shared in a way that is understandable to the different audiences. And of course, we can't forget the media, because the media is also very important in helping us to relay the information. In terms of the climate-informed health interventions for health systems, then we have the health outcomes, and then we have examples of what are some of the interventions that can be made. I'm not going to read through all of this because I know you have access to the slides. But if, for example, we look at a health outcome related to extreme heat and thermal stress, and I'm focusing on heat and thermal stress because it is hot, and I know getting hotter. And so some of the interventions could include developing an intersectoral heat health action plan and protocol. And this is something that countries are being encouraged to do, developing this plan, which would include public communication, early warning, preparedness and responses, the possibility of the implementation of cooling centers for populations at high risk. Some of the interventions could include ensuring a public health education to promote behavior change, improving the design of the health facilities, and so on, ensuring that the health workforce is aware of heat stress manifestations. And there are some other examples. So we look at, for example, if we look at environmental determinants of health, and if we look at, say, housing, who are the sectors that we need to work with in terms of collaboration? For housing, we need to look at housing and infrastructure sector, disaster management, met services, land planning. And so some of the examples of joint actions that can be implemented would include ventilation standards and improved housing and building design, health and public safety plans and training, zoning and building regulations for health and other infrastructure. So this is showing an example of what can happen when we have this collaboration. We also look at the health co-benefits of climate change, and this again is another opportunity for the collaboration with other sectors. When we talk about health co-benefits, we're looking at, for example, if we were to have more green spaces, more active transportations, walking and biking and stuff, driving, if we were to have clean air, what would it mean for the health of our populations? There are tools that have been developed by WHO that are used to assess the impact of these interventions with on the morbidity and mortality, and then to put a dollar figure to it, to be able to say, if we were to do this, if we were to improve in terms of having more green spaces in a city, if more persons were biking or walking than driving, if the air quality were better, what would it mean in terms of a dollar figure for the economy? Because then I think when we can present to the powers that be, when they see the dollar figure, then it might speak more to that audience. And then it gives projections as to what will happen could happen in terms of lives saved and so on. In terms of and I'm wrapping up just now, and I'm looking at governance and institutional structures, which also is part of strengthening the climate resilient health systems. And so one of the things that we're looking at is the empowerment of the health sector to be able to engage on the national and global regional stage where climate change is being talked about. This has happened, it has started with last year, COP28, having the first health day ever. And so there was an opportunity for this to happen. So with health being at the table, then we can have a strengthened argument and strengthened commitments, renewed commitments towards looking at what could be done, working with different sectors between the nexus of climate change and health. And so with health being empowered, then health can go to the table to have the discussions with other sectors. And so we look at these strategic planning documents where health is positioning itself in the climate change space. So when we look at, for example, the nationally determined contributions, which each country does, then there's the opportunity for health to be now included in those nationally determined contributions. Countries also have national adaptation plans, and we're working with countries then to be able to develop their health national adaptation plans. And these plans are strategies which are focused on the health sector, and this is how we will ensure that health and well-being of populations in the face of climate change are addressed. And so in conducting the health vulnerability and adaptation assessments, which is where we started, as part of the national adaptation process, then we will be able to identify the vulnerabilities. So that's the gaps, the barriers and opportunities, and then be able to inform high priority actions included in the national strategic documents to ensure that they are evidence-based. So I hope I have presented something that gives food for thought and some of the actions that are necessary to be able to strengthen climate resilient health systems, and how it is that we need to and can collaborate with other sectors to be able to achieve this goal. So with that, I say thank you, and I hand back over to you, Mr. Moderator.
So I want to say a good night again, good day, and thanks again for sharing such good information. I was fortunate enough to hear you speak on Tuesday at the next session we had at the ministry. And again, it's always thankful to hear different islands say different things and try to influence Trinidad in making some better decisions. So again, I want to say thank you. We have some questions. Again, for Dr. Wright, she was unable to rejoin us, so we'll be sharing the slides and presentations to the group. So a question to Dr. Polson. Could you please give some examples of how countries in the Caribbean are building resilience in their health sectors?
Thank you very much. I'm glad it's the first question I can answer. Yes. So how countries in the Caribbean are building this? So we as in PAHO, we do have a project or two projects actually, through which we have got funding to assist countries and specifically countries in the Caribbean for building climate resilient health systems. And so one is a project from the funded by the European Union, which covers the entire Caribbean, and that also includes Haiti and Dominican Republic and Cuba. And then we have another project from the Green Climate Fund, which covers 7 countries, and both are in sync. Projects are in sync, and they're looking at strengthening climate resilient health systems. How exactly are we doing that? If you recall, I would have mentioned in the beginning the building blocks that we were working under. So we have been working with countries to develop their health national adaptation plans. We have done that with Grenada, St. Lucia, Barbados, the Bahamas, now doing with St. Vincent and the Grenadines, Belize, Haiti, and Jamaica. And I'm sure I'm missing somebody. We also have been doing capacity building. So part of it is this training that is taking place, and there have been trainings done before. We're also working with the health sector in terms of them having building these intra and interministerial committees on climate change and health, and providing opportunities for health to engage in the discussions that are taking place with respect to climate change and health. The Smart Hospitals project, which I mentioned, is one that the Caribbean has benefited from and was funded by the UK. And that is another practical example in which a number of health facilities in Caribbean countries, not all, have benefited. And Dr. Dawkins-Wright, I think, would have spoken to that. And Dr. Harvey, I believe, will also speak to that next week in terms of how that has been done. So there are several ways in which we have been working with countries, specifically in the Caribbean, for strengthening that. And I'll end by saying we do have a Caribbean Action Plan for Health and Climate Change, which was launched in 2018 and signed by ministers of health and the ministers of environment of the Caribbean. It was a 5-year plan, ended last year. We're evaluating it now. That is also a framework specific for the Caribbean under which we have been working. Guyana has benefited. Thank you. I'm seeing the comments coming in.
So I just want to say thank you for the answer. Being somebody who was trained in the Hospital Safety Index and actually trying to do that assessment starting this week, I think I'll be contacting you very often to get to pick your brain, to get some information on the way forward. So now
yes,
we
sir.
have the second.
Thank you, Mr. Moderator. Thank you. Let me just say I saw Haiti was asking the question also about how we're working with Haiti. Despite the situation there, we have been and are working with Haiti under both projects. And there are stakeholder consultations taking place. Some have happened already in terms of doing a gap analysis. The next one is on hold because of the situation, but we are also working with Haiti to develop its health national adaptation plan. Thanks.
Right, so the next question, how would you recommend healthcare professionals can leverage their collective voice to encourage and promote early warning systems and the implementation of interventions for high-risk Caribbean patient populations in the face of climate change?
Okay. I will start, and I'm sure I will have a faculty member jump in. I'm looking at Dr. Hospitalis. How can healthcare professionals do this? First of all, it's by increasing their level of awareness in terms of the nexus between climate change and health. One of the things that we've recognized, and I know Dr. Hospitalis can speak more to this, is that from research done from surveys, we've recognized that in the health fraternity, the knowledge of the impacts of climate change and health and the relationship is not very strong. In terms of the work that's been done in the inclusion of this area of climate change and health on curricula of medical schools and secondary schools and so on, that's another area that is being pushed with Earthmedic and others. But what we have done through the trainings is to build the capacities. We have sorry, I don't have an example of it here, a sample of it here. We do have a pocketbook that PAHO has produced, a pocketbook for health professionals on climate change and health. And so the thing is that we're working with ministries of health, yes, through different sessions and having different fora. And then collectively, once Ministry of Health gets itself organized and persons get themselves organized, then I think that voice can be stronger in terms of lobbying for some of the changes that need to be made in terms of patient care and so on. But I see Dr. H has come to support me. So I'll ask him to go ahead. You're muted, Dr. Hospitalis.
Thanks, Karen, for that great presentation. I'm sorry we couldn't hear all of Nicole's details, and she was tuning in from Dubai, so the other side of the planet. Yeah, I'm happy to add to what you were saying about the important role of health professionals. I imagine most folks on this course are health professionals. And let me tell you, you have a really important leadership role to play in society. If you look at surveys from all over the world about who people trust in communications, who they think is honest, it's nurses, it's doctors, it's pharmacists. They don't trust politicians, they don't trust telemarketers, but they trust us in the health professions. And health is a bit late to this dance where climate change is concerned, because it's the Paris Agreement on climate only had health mentioned in it once in the preamble. But health is extremely important, and the vulnerabilities and the health impacts that we're experiencing and the health services impacts are important to communicate. That's why I've been pushing so much for us to research and publish. But the role of the health professional cannot be overemphasized. You may think, oh, I'm just a doctor, I'm just a nurse, but people trust you. And so I think as important as treating patients is advocacy and communication and education to the elected officials, to your colleagues. Go talk to the hospital management where you work, talk to the health center, ask them what they're doing about climate change. If you're in an academic institution, go talk to the dean. Last week, I was in Jamaica and I had the privilege of meeting simultaneously with the president of the medical council, because they do the continuing medical education. And I asked, how are we going to integrate climate into this? Not add something new, integrate. I met with the outgoing president of the Medical Association of Jamaica. Same conversation. How do we get this integrated into the programs? And with some of the senior faculty and professors at UWI, we're going to have a meeting next with the dean of the School of Medicine. How do we integrate this into the education of medical and nursing professionals? So I think, yeah, thanks, Karen. We're trusted in professionals in society, and we have an absolutely critical role to play to wake up the health system and the society at large.
Dr. Edwards, the last question. What are the main challenges in the process of building a health resilient system and maintaining smart infrastructures?
The main challenges, okay. One of the biggest challenge I find is getting health on board. As Dr. Hospitalis mentioned, health is new in the dance where climate change is concerned. And so there has not been that foundation, so to speak, of health personnel thinking of climate change as something that's, really intertwined with health. That being said, the other challenge then has to do with the lack of, so to speak, or insufficient political will from the higher levels to have to make the investment in climate change and health. The other challenge is that climate change, once you say climate change in a number of countries, they think that health should not be involved. Climate change belongs to sustainable development, or it belongs to environment, or there is a ministry that is a ministry of climate change. And so the main challenge there is that health has had to find its voice and to be able to position itself in the arena. I think those are some of the challenges I would want to highlight. Another one possibly is related to resources. And this is where we're working with countries to build a pipeline of project proposals that can be submitted to funding entities to receive funds to be able to implement some of the actions. Once the health national adaptation plans are done, then there are actions there, they're costed, there's a budget and they're prioritized. There's a chart with in the sense of, who has responsibility for what. And so once the funds come in, then it would be easier to begin to implement actions in the Health National Adaptation Plan. And I think the final part of the question is related to maintenance of the smart health facilities. It is a challenge because in a number of instances, there is not a maintenance plan or a maintenance unit for the Ministry of Health. And so once the facility is completed and handed over, then there is that challenge with maintenance. So it's something that, again, there has to be the will and the commitment to continue some of these things, because once it's done on that project, usually the sustainability is the issue. But I think if there is usually a maintenance plan attached to it, but there has to be the investment from the side of the country to follow through with these activities.
So Dr. Polson, I have a few more questions and then we wrap up for the night. Getting one, is there perhaps a revitalization mandate for government statistics office to facilitate cross-sector and interprofessional department data integration?
If there's a mandate, there is a challenge, and this is in having discussions from the CARICOM level with data sharing. Yes. We do not in the Caribbean have data sharing policy across the board, and that is a challenge. Even internally, I've been in situations where one sector is saying, I'm not going to share the data with the other sector. So if we're having those issues internally because we're still working with the silos, then you can imagine regionally it would be a challenge. So that is something that is a constant problem. And so we're trying to, last week, I think, was a good starting point for us if we look at the Met Services and Health, because there was this meeting, as I mentioned, and we were sitting down together for the first time, and there was information being shared and so on. But from other sector, with other sectors sharing information, is one of the things we have to keep working at is breaking down the silos and building that trust. Because one of the reasons also that persons do not want to or are hesitant to share data is the trust factor. What is going to happen to my data? What are you going to do with it? Who will have access to it? So I think if we're able to continue the discussions to show how it would benefit all sides, then we will begin to see some movement where that is concerned.
Right, so I have two more questions. One coming from Andrew. How do you bring all these stakeholders on board for the health and climate integration?
So if we're looking at the national level, we start with, a practical example I will give. In the Green Climate Fund project, one of the first things that we have as an activity is to establish interministerial committees on climate change and health. And when it came to implementing the activity in the project, we recognized and realized when we spoke with the health sector that, listen, we're not ready yet to integrate with anybody because we ourselves need to get our houses in order, our house in order. And so we had to turn around and then decide, okay, let us focus on the Ministry of Health first. I think once the Ministry of Health is ready and confident, then the ministry and can, because if you don't believe in something, you can't sell it. So I think the Ministry of Health is confident, ready in what it's doing with the support from other other entities like PAHO and CARFER and so on. Then it can begin to meet with others. So in a case of one of the countries, once that was done, then the Ministry of Health said, okay, now we are ready and to engage with other sectors and we want to plan the stakeholder consultation. It happens also when the vulnerability and adaptation assessments are being done in countries, there is that consultation because it is a requirement. And additionally, when the health national adaptation plans are done, they're heavily dependent on stakeholder consultations, and that is where it starts.
The last question, are there efforts to collaborate, share expertise, and respond to climate change needs at an intersectorial level and interdisciplinary level?
Yes, there are plans. So if, for example, we look at, so one of the things we recognize is that a lot is happening in climate change and health space, especially in the Caribbean. And so we're having discussions as to how to bring this together, to bring everybody together, to have a platform for sharing of experiences, for sharing of knowledge, that kind of a thing, so that we can all benefit from each other. And it's something that we're actively working on. So there are plans for that. With respect to, if we look at a practical example again of what we're doing, when we speak about the health co-benefits, and we're looking, for example, at air quality and how that impacts on respiratory illnesses and, you know, possibly death and so on. The working with bringing together the sectors, like, for example, in Trinidad and Tobago, it's the Environmental Management Agency that has been working really well on that. And health is now, you know, working with them on that. So there are entities that have seen the value and is to begin to join them up. So it has started.
So again, Dr. Edwards, I would like to say thanks again for all the information shared. And tonight's biggest takeaway is the data information sharing age that we need to start adopting in the Caribbean. Because in at where I work, it's the same problem, the sharing of data. And I think because the lack of sharing of data, things can't go forward. So again, I want to say thanks for the information and sharing your data tonight. And I hope that a lot of people take away from it, that we need to open up on data sharing and data gathering.
Thank you very much.
I want to say,
Dr. Hospitalis. Sorry. Dr. Hospitalis, his hand is up.
Thanks. I wanted to give another example of how health is bridging into other areas. So posted on the course chat, and if you haven't joined the WhatsApp chat, you should. Posted on the course chat a week or two ago was an article on how various courts, the law courts in international law are beginning to pay attention to climate change and its impact on people, vulnerable people, small island states. And I was pleased we participated recently in the International Court of Justice advisory opinion on the obligations of states, and were able to use health impacts to enrich national submissions to the International Court of Justice. And some folks, for example, from Barbados may know that the Inter-American Court of Human Rights is currently meeting in Barbados, and that also we've tried to put in a few of the health human examples into the discourse. And even the lawyers themselves point out that the human stories strengthen, because the judges are human. The judges are human. So if they can see the human health impact in these presentations, then that helps to create more momentum for the need to pay attention to health.
So again, thanks, Dr. Hospitalis, for that segment. And again, I would like to say thanks to all the presentators, Dr. Wright, Dr. Edwards, again, for all the information that was shared. Dr. Wright's presentation would be submitted by email. So I hope that we do start collecting and sharing data. Haley, I'm not sure if you could hear, just post the link for the survey into the chat. Thanks. Hi, so good night, everyone, again. Thanks for coming. Please do circulate these sessions. Please do let everybody get involved. Again, spread the word. Again, tonight's takeaway, data sharing. So we need to have this data outside. We need to have this all over the place. So a lot of people would start to take some interest in it. Again, we're looking at the next session. That will be session 9, which will be Tuesday, the 30th of April. And we have three people and one moderator. We have Miss Antonella Risso, the founder of Ambient Sano, Julieta Frederick Cassius, and then we have Dr. Judith Harvey. And then the moderator for that session will be Dr. Daniel hoping that I'm pronouncing the word right, Maghalis. So again, I want to thank everybody for coming out this afternoon and sharing. Again, data sharing is the most important thing. And again, I want to say thank you and spread the word. So again, if you look at the screen on your right, you'd see the post-session survey link, and then the link is being posted into the chat. So you could complete the post-survey session, so you'll be able to get your CME credits. And again, I want to say thank you and enjoy the rest of the night, enjoy the rest of the day, or enjoy the rest of the afternoon.